are live here at Global Aesthetics Conference 2019 in beautiful Miami Beach, and I'm here with Alex Rivkin, and we're going to ask you just a few questions about yourself.
Sounds good. Good to
So
be here.
first of all, tell us a little bit about you.
Well, let's see. There's lots. So the practice is I live and work in Los Angeles.
Okay.
And originally from the East Coast, and so as we were saying, I appreciate the good weather. It's always it's always nice to have sunshine a lot, most of the year. It's always a good thing. And not from this country originally, so from the place that no longer exists, which is the Soviet Union.
Okay.
And came here in '75.
Wow.
So settled in Boston, then moved out west.
Wow. Okay. So we'll start off with an interesting one. If you could sit down with your younger self, your 25-year-old Alex, and tell him something, or younger Alex, what would you say? What would you?
I think, and it's when you're young, I think we worry a lot about what other people think of us, and we don't. And it's easy to say. It's I'm sure it's hard to do. Was when you're 25. It's easy when I'm sitting here at 50 and saying, "Oh, you should really believe in yourself."
Yeah.
But investing the time to know yourself and to believe in yourself, it's really important. You make good decisions that way. And I think a lot of times I know when I was younger, is I worried a lot about what other people thought, what my parents thought, what parents wanted, what other people wanted, and impressing people. And it's just, you don't pursue what's inside you, and you don't develop what's inside you as well as you should. And I think that's something that's important. And knowing yourself in general, that I'm good at this, and that's good, and I'm not so good at that, and that's okay.
Yeah.
I think that's important,
And also doing things for yourself, or doing things with yourself
yourself
in mind, not what others are going to think, or parents
or
are going
like
to
what
think.
you should be doing, Because that's the thing. People talk, when you're young, it's a lot of should. When you're older, you don't, they don't care as much anymore. And it's something that I think it's important. It's nice because it's as you go on, and I mean, as I go on, one of the things that I reflect on is that if I had just known myself better, that I wouldn't have done this, which led to these things which weren't that great.
Yeah.
So if I could knowing yourself, it's important. I almost think I think therapy should be a required course in medical school. Do a little, get in there and talk about some of these things.
I feel like some people are maybe a little fearful to know themselves.
I think that's very
interesting.
I think that's very true, because you don't. And I think, I remember. Actually, it's interesting you say that. I very specifically remember that when I was quite young, when I was in my early 20s, I remember thinking that. I'm like, maybe there's like something really nasty, awful, horrible in there.
Exactly.
Maybe I'm like, geez. And I'll discover something that'll be like really terrible.
Yeah.
But you don't. You got to have faith, and you got to know that what's in there is good. And whatever is in there, you're stuck with it. Doesn't matter.
Exactly. It's going to be there no matter what.
Yeah, it better be nice to yourself, because there's you're there with you.
And if you know the demons, you can fix them. You can work on them. I mean, you can't just ignore it and expect it to all of a sudden be better.
I think so. So that's what.
That's a really good piece of advice. Yeah.
So.
Get pretty deep on that one.
Yeah.
Anyway, switching gears real quick to your profession. So what is it about your profession, what you do, that you love the most?
I think it's we all go into medicine. At least people that sit here in this chair go into medicine, and we want to go into medicine to help people. And I think most people go in to help people, and that's for the right reasons. But as you go through the process, there's certain parts of your personality that are amplified, and there's certain parts of your personality or yourself that are a little bit suppressed. And I think as you go through medicine, some of the creative side of who you are is suppressed, because there's a lot of things to learn, and there's a lot of ways to think about things that you have to absorb, and how to process situations logically, how to act efficiently and effectively, how to analyze conditions, analyze situations, and pick through differential diagnoses and all this kind of stuff. So, and that's great. You have to do that to be an effective doctor. But one of the things, before medical school, if you remember, if some of these docs remember that, and I certainly remember that before medical school, I would enjoy being creative in various ways, whatever they were, whether you sculpt, whether you make music, whatever you do. In medical school, sometimes there's not a lot of time for that, and there's certainly not a lot of ways to do that in medicine as part of your profession. And so when I was getting out of the whole training aspect of things, I was thinking, it would be really nice and I started doing some of this more aesthetic work. I thought, this is really cool. This is really cool that I could do. First of all, make people feel better about themselves and have more confidence, and treat people, and also use that creative aspect of myself and exercise that creative muscle. And I think that was cool. That was nice. It's a unique.
I've heard both of those things separately, but not together. I've heard that a lot of doctors, you spend a lot of time studying. There's a lot of you've missed out on, essentially. And then there's also, I've heard a lot where they talk about how it's a very creative, it's an art, but it's kind of nice that you see, okay, well, I sacrificed some of that more creative when I was younger, but now I get to be creative again. So that's pretty cool.
And I missed it. I specifically missed it, and I thought that this is there's a certain. It goes back to what we were talking about before. Is to kind of know who you are. Sometimes you learn who you are with experiences as you go through life. Yeah. And one of the things I learned as to who I was that I missed that creativity. Yeah. And I didn't know I would, but when I did, I paid attention to it. And so being able to do that now is nice. I mean, to think that I could, do that. Yeah, to think I could get both. Yeah, it's kind of like having your cake and eating too. Exactly. It's really pretty cool. Yeah,
I like that. I like that outlook. Yeah. Talking about having both. If you weren't in this profession, what is it that you do?
It's funny because sometimes we were. A friend of mine is from Uruguay. Okay. And we were having that discussion a long time ago when we were residents. We were talking where I still remember this conversation. We were talking in a restaurant. I'm like, what would you do? What would you, if you could do anything, what would you do? And and I was like, I was like, well, I want to be a rock star because it's pretty cool. You're on stage and everybody loves you, and you're just doing this, you're singing or you're playing your instruments really awesome, and touring. It's great. He's like, no, that's nothing. It's like, that's nothing. He's like, I want to be a professional soccer player in South America. That's it. That's the bomb. Like, yeah, that's pretty good. as far as this adulation scale goes, that's pretty high up.
That is pretty high up there.
So I don't think I would be a professional soccer player in South America. But if I wasn't doing this, I think I don't know. I was thinking about academics, being a professor. Okay, it's interesting. Sort of the more kind of it's because it's always being in a university setting is nice. Keeps you young. You know? So I teach at UCLA, and I always look forward to that when the class year starts, and having new students and just getting their perspective and seeing how it keeps you young. It's nice.
That's awesome. Well, thanks so much. It's great learning a little bit about you.
No, my pleasure. Thanks for having me.